So this was a study. So we're doing a prospective study in patients with follicular lymphoma. And one of the unique things about follicular lymphoma is that not all patients that get diagnosed need treatment right away. So we are prospectively following these patients to see how their disease changes over time, something we might call clonal evolution. And we're including patients that need treatment right away. We're also including patients that don't need treatment right away. And we're then going to compare, the immunologic and the genetic profile of tumors that progress quickly after diagnosis compared to those that in patients that can wait a while. So that's the ongoing study. We've enrolled over 80 patients. And what this particular abstract was focused on was how one might use assays of circulating tumor DNA to monitor these patients. So we were using a ctDNA assay that tests for the VDJ segment of the immunoglobulin receptor. And we were correlating it with, traditional measures of tumor burden, such as, PET scans. And we showed that there's a pretty tight correlation with total metabolic tumor burden, for example. And we were also looking at how this changes over time. So if we just look at patients that progress, we can see that oftentimes their levels are very, very high at the beginning, or they go up before they need treatment. And other patterns we noted in patients that didn't need treatment, or non-progressors. So these are patients that have gone at least 2 years and not needed any therapy. You can see that oftentimes their ctDNA levels stay very, very stable, and they don't really change, or in some cases they go down. So we've had cases that actually the ctDNA goes to 0 or undetectable without any treatment. And that tightly replicates what we see clinically, because some patients with follicular lymphoma will have disease go away on CT scan even without treatment. So this is presumably some effect of the immune system, the host immune system. And so we had a few patients that we knew had spontaneous regression on CT scan, and we looked at the ctDNA, and you can see a similar pattern that it goes down and it correlates pretty tightly with CT scan decreases. So that was a unique finding that we have never seen before. And so, future studies, we're going to try to get at some of the mechanisms here. What are some of the immunological mechanisms at play? Presumably T cell responses or something like that are correlating with these changes seen on both CT scan as well as in the blood.